Hey y'all, Dr. Amaka here. So, top five things to ask at your plastic surgery consult, right? So one thing to ask: are you board certified? Right, number one, right? And it's not just about board certification. What are you board certified in? Right. So, are you board certified in plastic surgery? Is a question you should be asking. Now, some initially when you come out of training, like when I came out of training, you are board eligible. And people would ask me, like, what does that mean? And I would explain it. And I also want to specify that all the questions I'm going to tell you to ask, people have asked me, and I'm not offended, right? So these are all questions you need to ask. That's number one. Number two, do you have privileges to do the surgery that you want to do to me, whether it be facelift, tummy tuck, breast aug? Do you have the same privileges to do this at a hospital, at a nearby hospital? And ask what hospitals are credentialed at that are close by. And that's important because the hospitals have a really different certification process to make sure that a surgeon should be doing a surgery that they say they are credentialed or able to do. What they look at is they look at your training, they look at how many you've done. They kind of comb through all that, and that's a medical board at the hospital that does that. So that's the second thing you want to ask. Third thing you want to ask: how do you manage complications? Ask them how they manage complications. So, you know, ideally in an ideal world, there's no complications, right? But that's not realistic. This is real life, right? Things happen, especially if you. So one thing I heard that stuck with me is that if a surgeon tells you they're not having complications, then they're not doing surgery, right? So complications will happen. The rate should be low. Ask complication rates, but also ask how do you manage complications. If a patient has a problem, who do they reach out to, right? Or do patients ever have trouble reaching your office if there's an issue, right? So that's the next thing you want to ask. So, additional thing to ask is how do you manage an unhappy patient who maybe needs a revision or would like something changed about their result? Again, the reality is if everybody came out 100% like this result is perfect, that's just not realistic, right? And if a surgeon tells you that, then they're not doing surgery, right? So I'm just sharing the real thing with y'all. So ask them how they manage that. Like, do you listen to the patient's concerns, and then what's the process after that if a revision needs to happen, right? So those are four things. So the fifth thing to ask is ask them their protocol for what happens if there is an emergency, right? Especially if they're operating at a surgery center, and what's their protocol if there's an emergency? Like, what hospitals are you credentialed with? What happens then? These are all really safety questions, right? To make sure you're in safe hands. Now, it's another ball game, and I can do a part two if y'all would like on results, right? And that kind of thing. But the other side notes, like let's say the top five, these are like other side notes. Look at the reviews and comb through the reviews. If you see a recurring theme like patients not able to reach somebody or other issues, like just pay attention to that, because usually if there's red flags, there's a recurrent theme. Look at the photos, ask them like how many of this have you done, are you comfortable doing it? Just really really dig deep.